Hello and welcome to our channel. Today, we're diving into an intriguing study from the University of Cambridge that challenges the traditional doctor knows best approach in healthcare. Stay tuned as we explore what this means for patients and clinicians alike. The study, conducted by the University of Cambridge, shed light on the relationship between clinicians and patients, especially in the context of diagnosing illnesses. Researchers found that the traditional view where the clinician's opinion is paramount often leaves little room for patients' perspectives. But why is this a problem? Let's find out. Patients bring their lived experiences to the table, which can provide valuable insights into their symptoms. Dr. Melanie Sloan, one of the study's lead researchers, emphasizes the importance of valuing these insights. But the study revealed that most clinicians don't fully consider the patient's viewpoint. This can be a major oversight, especially in complex cases. To illustrate this, the study focused on neuropsychiatric lupus, a challenging condition to diagnose. It affects the brain, spinal cord, and nerves, with symptoms like seizures and psychosis. Surprisingly, almost half of the surveyed patients reported that their self-assessments were rarely, if ever, solicited or aligned with their clinician's views. The study advocates for a shift towards a more equal clinician-patient relationship. Sue Farrington, co-chair of the Rare Autoimmune Rheumatic Disease Alliance, highlights the need to move past the doctor knows best attitude. Instead, she suggests a collaborative approach, combining patients' lived experiences with doctors' learned experiences. However, implementing this change isn't simple. Dr. Sloan points out the time constraints faced by clinicians in current health systems, which makes thorough exploration of each patient's symptoms challenging. This study, part of the Inspire research project and funded by the Lupus Trust and Lupus UK, opens the door for future research and policy changes in healthcare. As we wrap up, it's clear that the path to better healthcare lies in valuing both the doctor's expertise and the patient's experiences. What are your thoughts on this study? Let us know in the comments below. Don't forget to like, share, and subscribe for more insightful content. See you in the next video. Thanks for watching our channel.